Hi there, we're going to talk about the use of ultrasound today in the investigation and management of varicose veins. Ultrasound is now central to the treatment and investigation of varicose veins. So what are varicose veins? They're very common, but by definition a varicose vein is an elevated vein above the skin more than 3 mm in diameter when the patient is in an erect position. Often there may not be very obvious varicose veins on the surface of the skin, and there's serious underlying problems with the venous system. And on other occasions there may be veins that look quite obviously varicose, but in fact physiologically there's not really too much of a concern because the veins are actually working. Ultrasound can help us to establish which veins are working and which veins are not working. So initially we use ultrasound to do a complete mapping of the venous system in a patient's leg. We look at the superficial veins and we look at the deep veins. The deep veins are the veins that do most of the work in clearing the used blood out of the leg and returning it back to the heart. This occurs when you walk. Your calf muscles contract and compress the deep veins and push the blood up. As you may probably know by now, all veins contain small valves which point back to the heart. This prevents blood reversing back down towards the bottom of the foot. We want venous blood to get out of the leg so the new, fresh arterial blood can get into the leg. Ultrasound allows us to see veins deep under the skin and also to dynamically test them to see whether or not they're functioning properly. We can see whether the vein is pushing blood back to the heart and if it's doing it properly, and whether or not blood is leaking back in reverse down the leg. Most patients with severe varicose veins normally have saphenous veins in their leg which are responsible for causing the varicose veins down distal to the knee. Patients often present with lumpy varicose veins around their calf and they say, "Doctor, can you treat these veins?" But what we actually do first is we look above their leg and we look in the thigh region because that's often where the problem originates. This is where the original sin occurs. It is the saphenous vein which is large and hidden and it is failing. Saphenous comes from an old Greek word meaning hidden. With ultrasound we can see that vein. We can test it. Normally it is about 3 to 4 mm in diameter. If it's larger than that, due to varicose vein disease, the vein will appear perhaps more than 5 mm in diameter. Sometimes these veins can be up to 15 mm in diameter and yet not reveal themselves on the surface of the skin, but they give themselves away by the fact that beneath the knee there are large varicose veins. So the ultrasound allows us to see these veins and to treat them. We use endothermal ablation to treat incompetent saphenous veins. We use ultrasound-guided sclerotherapy normally to treat incompetent tributaries distally further down the leg. Once we've used the ultrasound to treat these veins with either endothermal ablation or ultrasound-guided sclerotherapy, we then need to establish whether or not we've been successful in occluding these veins. And this is where ultrasound is so useful. It not only maps the veins, determines which veins are working, which veins are not working, it allows us to guide our treatment and it allows us to establish whether or not we've been successful in treating the varicose veins.